Hello, everyone. Thank you for joining us for another video. Today, I have the pleasure of having Dr.Roig Roa with us today to answer a couple of questions. Welcome, Doctora.
Hi, thank you for having me.
Thank you for being here. We are more than happy to learn more about your journey and from your experiences. And so just a fun question to get us started is if you can tell us a little bit about where you're from and where did you go to undergrad?
So I am from Puerto Rico. I went to college to Universidad de Puerto Rico, Recinto de Rio Piedras, this is the UPR, Rio Piedras campus. And I was born and raised in Puerto Rico. I'm from Arecibo originally, and I love my island, but I did go to med school in UAG.
Awesome. That's great. I'm glad that you are the first Puerto Rican student that I interviewed that matches into Puerto Rico. So congratulations.
Thank you.
A little bit about your journey. I wanted to ask, when did you start UAG, and was that in August or was it in January?
So I started at UAG in January. I got a little struggle at college because we had this how do you call that, like protests and stuff like that. So it got delayed, and I didn't even have a graduation, like a formal graduation from college. But it was fine. I was just ready to start med school, so I applied. I got in, and I was really excited. It was in January, out of the normal, process to start med school. But I don't think that I don't think that wasn't something bad at all, because it was ups and downs during med school, so it helped me get there. I don't know, it helped me a lot. Like January, I had a how do you call that, like a sabbatical semester. So by the time I ended that, I was back on track, like with the normal process, like getting into July and all the stuff.
Awesome. Yes. It's nice that it does give you kind of that break, I guess, opportunity if you need to take one, right? Because UAG allows one semester full sabbatical, right?
Yeah, that's correct.
Awesome. Okay, so in terms of graduating UAG, when did you graduate?
Okay. So just to be on the same page, my UAG is different from yours UAG, because I'm from the old program. So UAG used to have the fifth pathway, was the 5th year. So in order for you to get your title, you have to do one internship year, or pre-internship, how we call it. So I completed my 4 years in UAG, like in Mexico. So all my core rotations were in Mexico. So it's different from you guys. We didn't have the, we couldn't choose our elective. So that was kind of like a little bit of a bummer. But since we were in Mexico, we learned a lot. By the 5th year, I did my internship in Arizona, in Phoenix, and it was amazing. Like, getting to know medicine in the USA for me was like, oh wow, it's really different from Mexico. I'm pretty sure it will be more similar to Puerto Rico, and that helped me a lot. After graduating and getting my internship and getting my title, I landed a job with an internal medicine doctor as her scriber, which actually was more than a scriber, because I was actually seeing patients, evaluating, doing like the plan, the constellation of medications, like having all this exposure that I didn't have back in Guadalajara with US patients. Like, it's different, the population is different. I also had a lot of like Latin community, but it was more towards like the American community, and it was different. The medicine is different. What else? So yeah, my UAG is different from you guys. I didn't get to choose my core rotations, but I had a great time like experimenting that. And by the time I came back to Puerto Rico, it was like, okay, I can do this. Like it's similar to the USA. I've seen a lot of stuff thanks to Mexico. So yeah, basically that.
That's awesome. Well, thank you for clarifying because yeah, you're right. We don't do the fifth pathway anymore. We do the
Mhm.
third year, fourth year in the States if we decide to, or in Mexico if we decide to stay as well.
Yeah. For me, like a recommendation, like I know Mexico is really different, but get as much exposure as you can in Mexico because you're gonna see, you're gonna learn, and you're gonna do things that you're never gonna be able to do in the States, or at least never be able to do as a student in the States nor in Puerto Rico. So for me, Mexico, like it helped me a lot, like doing rotations in the Cruz Roja, INS 110, like I went to Tequila. I like we saw everything. We got exposed to everything. It was like the real deal. And by the time I got to the States, I was a little scared because it was my first time with patients like from the United States. But I think I handled it pretty well thanks to that experience. So as long as you're there, just take advantage of that. Do some community outreach programs. Just take advantage of that.
Awesome. Yes. And how was your transition now that we're talking about Mexico going to Abrazo? How would you say that was different? Because I do have some classmates that are considering to stay for a fifth semester or their entire third year. You would recommend them to get that exposure?
Okay, so if they're deciding to stay in Mexico, that's amazing because they're gonna see and they're gonna learn a lot. They also have to consider that they have to get some exposure in the States because if they're planning to apply for residency, they have to show them who you are. Because for me, the key for my match was to go there, do a rotation, and show my work, show that I was confident, that I could deliver, that I was responsible, that I was resourceful, that that helped me a lot in the interview and getting the match. But if you can stay 1 year, maybe a couple of months, maybe a semester just in the doing the Mexico thing, like in Cruz Roja, INS, that is I think that's a good choice too.
Awesome.
In the States, you can also do like you get more acquainted with the electronic record, which you don't get in Mexico. As well in Puerto Rico, you get the electronic record. You will see the population is different, but you're gonna be limited because you're a student. So they always tell you like you can do whatever you want as long as you show like interest, but there's some limitation in the States and in Puerto Rico.
Oh, okay. And well, I do have a question for those who are a little bit afraid to go to the States because of their English capacity for rotations in the States. And what would you say to those students?
Don't be afraid. I know me as like personally, I'm from Puerto Rico, so my first language is Spanish. Like I have a really thick accent, and for me was practice. You just have to go there, start talking. You speak with everyone. No one's gonna make fun of you. No one's gonna laugh at you. There's always some people that they don't like Spanish speakers or Latin community. Sometimes they just don't like you. It's not you, it's just they make it rough for you. But aside from that, you just have to go out there, practice, and you're gonna be fine. Like actually my roommate, she was kind of like she's also a UAG graduate. She was kind of like, oh, English, I don't know. My English is not that good. I don't know if I can make it, but I'm gonna be with you, so I'm gonna be fine. And like, you're gonna do great. Just practice. And at the end, like I left Arizona, she stayed and she's really fluent on English. Like, just don't be afraid. Like, it's gonna be an adventure. You're gonna learn. You're gonna make mistakes. Like, I sometimes I make a lot of mistakes, but they understand you. Like, they're gonna understand you. So just do it and don't be afraid. It's gonna be fun and you're gonna learn a lot.
Awesome. I'm glad. Thank you for speaking on that, just because it's always nice to hear it from someone who went through it and someone who understands how like it could be fearful, you know, for some of us to do that.
I totally understand. Yeah.
Yeah, thank you. Okay, so next question about you would be, well, of course, congratulations, you matched. And you matched into emergency medicine in PR, correct?
Yes, ciencias médicas or centro médico, how they call it. It's like the UPR recinto of medical resident. I don't know how to say it in English, but it's like the main campus of medicine in Puerto Rico. There's one hospital that has everything. That's Centro Médico. So I will be doing my specialty in emergency medicine at Carolina campus. It's another hospital, but it's with the program, like with the main program.
Awesome. That's really cool. I wanted to ask you a little bit more about emergency medicine. If you can explain to those who don't really know what that is, and how long the residency will be.
So emergency medicine, okay, I'm gonna be really straight with you. When I was applying to emergency medicine, a lot of people, like friends and co-workers, told me like, why would you apply for emergency medicine if any general doctor can work at an ER? And I'm like, yes, it's right, you're true, it's true. Anyone can work at an ER, general practitioner, but it's not the same as having, like, being prepared for ER. Like, you're gonna be an emergencyologist, you're gonna deal with the problem, you will know how to do it, like the proper way, follow the guidelines, you're gonna have a great preparation, it's gonna be 3 years of full exposure. When I did the internship, I'm doing an internship in Hospital Pavia de Recibo. It's like what they call internado criollo. It means like from Puerto Rico to Puerto Ricans just to become a general practitioner and get your license, like your fully restricted license to practice medicine in Puerto Rico. So through them, I was able to go into the ER program and do a 1-month rotation with the ER Federico Trilla Carolina UPR. That's how they met me, and that's how I met them. So before applying to them, I did this rotation at Hospital Pavia de Recibo, which is one of the clinical campus of UAG. When I went to the ER, I was like, oh my God, I really like it's fast, you get to solve stuff, you have to be quick, and you're always like on the edge, like there's always something different, like you see everything there. And I was really excited because first I was aiming to become an internal medicine doctor, but then like when I saw ER, it was like, oh my God, I think this is my calling. That's when I met Dr. Racheli Abreu. She did emergency medicine at UPR Carolina. And she's like, have you considered being like an ER, like doing ER, like as your specialty? I was like, no. And she told me like, I think you're gonna be good at it. You should consider it, and I'm gonna give you a letter of recommendation. I was like, that's great. Let's do this. Then my program director heard that she was like trying to push me in that direction, so he found me the spot there, and I met the residents, I met the program director, I met like the whole team of emergency medicine there, and I was like, oh my God, this is so different, because I've been in ER at Hospital Pavia de Recibo, and being here where there's actual residents, there's an actual residency program, the way they do stuff is really different. Like they go by the book, you learn how to treat a patient at the ER setting, because it's really different. Keep in mind that when you treat a patient at the ER, when you treat a patient in outpatient clinic or in hospital admitted patients, it's different. Everything is different, like the management, the medications, the patients, everything is different. So I really love how I got to see that, and it was like a reassurance for me, like, okay, this is what I want to do for the next 3 years. Like, I was really convinced. And sometimes people say like anyone can work at the ER, but to have the correct, like, to have the tools to actually manage an emergency the right way, it's different. And for me, it was really gratifying seeing that, okay, I've seen many doctors at the ER doing this, but now I know this is the right way to do it. It's not bad, but it can be better. You can be more prepared. That's the thing. Like, when you're at the ER, you need to solve the problem that is in front of you at that moment. You don't have to diagnose right away. You don't have to think, like, you have to solve what's in front of you. And once you stabilize the patient, then goes the diagnosing and all the stuff. But it's amazing. Like, for me, like, everyone was really excited for me. But to be honest, a bunch of people just say like, oh, but ER, that's something that's like general, and like, not really.
No, not really. Oh, I thank you so much for explaining it the way you did. It really shows that you know what emergency medicine really is, and that you're so passionate about it. Like, it's really nice to see that you matched into somewhere that you really like want to go to, and you were like super excited for it, and I'm happy for you.
Thank you.
Okay, so in terms of backtracking a little bit into medical school,
Yeah.
did you have any extracurriculars during medical school?
So what I did mostly, since again it's different from you guys, I was in Mexico. I did some outreach programs where I got to visit communities that they didn't have medical service, and we provided for them as students, and we saw how these communities struggle because they didn't have any kind of medical service. And when you're there, even though you look really young because you're a student, they treat you as like the real thing. You're a doctor, and they're really like grateful for you. So that I put on my CV, my resume, because seeing that, working with that people, doing that outreach program, I believe it helped me, but also it looked good on mine. But I didn't do it at the beginning. I didn't do it because of my transcription or my CV. It was more like I wanted to see what was out there, and I didn't do any research, which I regret. But to be honest, sometimes you don't have the right people or the right mentors to do that. You need a whole team. Not all, like, medical schools, there's not one perfect medical school. I'm really grateful to be at the UAG. Again, it's not perfect, but in this field you have to be like, you have to learn to teach yourself, like, to do the things on your own, because no one is gonna hand you anything on the hand. Like there's no perfect way to explain that, but you have to look out for yourself, try to learn as much as you can, because no one is gonna take you by the hand and say like, you have to learn this, you have to do that, you have to apply this, you have to take the test at this moment. Like, no one tells you that, so you have to do a little bit of research on your own. But in terms of like extracurriculum, I did like 2 or 3 outreach programs, and that helped me a lot.
Awesome. Thank you for sharing. And you're right, it is important to be like proactive about what to do next, because there's a lot of steps for this medical journey. So just asking a lot of questions. So you kind of spoke about mentorships. Did you have any mentors? And if so, how did you find him or her?
To be honest, I did not. When I arrived to med school, I come from a family that there's no doctor. So when I arrived to med school, I was kind of lost. I didn't know the process, but I learned along the way. What helped me a lot, I did a lot of research on the internet, like forums, students.doctor.org or .com, I'm not sure. I did a lot of that. I asked a lot. I was always researching for stuff, like just going to the internet and look it up. Also, like you have upper students, like just ask them. If they don't know, then ask the Latin program. They have a lot of amazing doctors. They're always willing to help you, so you can use that as like
a resource.
Resource. Aside from that, I will say that for the MASH, my mentor was Dr. Abrazo, which I met in Pavia Hospital. But back in the UAG, I was kind of shy. I kept to myself or my friends. So I didn't found someone that I could say was my mentor. But I know of people that they made great connections and it really helped them as well. So just have to go out there and ask for help, and someone always gonna say, yes, I can help you, I can show you the right way. So in Mexico, I don't have someone that I can tell you, I just go to this doctor. But if you go to La Cruz Roja, there's always amazing doctors, amazing interns. Yeah, because of the interns, I learned a lot. There was someone I met in the 110 IMS. He was, now I can't recall his name, but he was amazing. He was a great doctor. He showed me a lot. I learned a lot from him. He was dedicated, he was passionate. So if you find someone in one of the Cruz Rojas, or if just keep in touch, talk to them, because you're gonna learn a lot, they're gonna teach you a lot, and that's basically it.
Awesome. Thank you so much. Yes, I think it's always helpful to ask questions, and knowing who to ask is important. So you just have to keep asking until someone knows the answers. So thank you for that. So in terms of step 1 and step 2, the next question would be about your 3rd and 4th year here in Mexico. And do you remember what hospitals you went to, and do you have any recommendations for those who are staying in Mexico?
Yes, I went to IMSS 110, it's 110. I believe it's in Las Aguilas. That was for my 4th year, I believe. Is it the 4th year? Yeah, I believe it was 110 IMSS. I did also La Cruz Roja, which my favorites were IMSS 110 and La Cruz Roja. I learned a lot in the IMSS 110. You have everything. Like you have internal medicine, you have surgery, you have like eye surgery, like you see everything there, like specialties, subspecialties, like it's a great, huge hospital with a lot of staff, a lot of students, a lot of interns, residents from Mexico. For me, that's a good place. The area, it's kind of like you have to be careful, let's be honest, like everywhere. But aside from that, it's an amazing place to learn. And Cruz Roja, they're always willing to help you a lot. And there you see like polytraumatized patient, you do sutures, you do like minimal procedures. So for me, those 2 places were my favorite ones. I also rotate in Garibay, Hospital Garibay. Since it's part of the hospital, I think it was a little bit more tight in terms of doing stuff. But the farther you grow from the school, the more you're gonna be able to do and learn, because they don't have that many restrictions for you. So basically, you're the doctor. If you're not scared of doing stuff and you really want to do, the farther, the better. For me, INS 110 was one of the best because there weren't that many restrictions and it wasn't that far from UAG, so I was able to get a cab or just jump in the bus or get a ride with a friend. So it wasn't that bad. But for me, those were the places like my favorite places.
Awesome. And do you by any chance remember how your hours were like? Were you there all day, half a
So
day?
for studying, it was kind of hard. What I used to do, because I was supposed to get there at 8. Some people were, it depends on your attending, but some people were supposed to get there at 6, 7. And you don't leave until, let's say, 2, 3 p.m. So it's kind of hard on your schedule. What I used to do is that I was always carrying my first aid, which I have right here. And every time I was in a rotation, internal medicine or cardiology or surgery, I tried just to take my first aid and do the notes like, hey, this is important for the step, this is important like for that and that. So by the end of my rotations, I pretty much went through the whole thing and I have all my notes. I also did the same with the patoma thing. Like every time I saw something really important, I just make like a little post-it and put it on the book. So by the time you're gonna start studying for step 1, you're not like, oh, this book, this first aid, I don't know what to do, it's too short, doesn't have the full explanations. You're right, it's just a review. You have to know the whole thing prior to reviewing a review book. But for studying while you're doing the core rotations is tough. So you have to be really how do you call that, like focus and take your book, and every time you get a chance you can review stuff and learn stuff and just put it on your book. So when you go to study and do the questions, it's gonna be easier for you because you already went through the book. So yeah, it's kind of hard. I believe like the best rotations to study, like to do while studying, it will be PITS and internal medicine, because even though internal medicine is a lot of work, you learn a lot. Like you learn what you have to learn. Like, and also surgery. There's some surgeries that are like easier than the others. So if you go to general surgery, like a rotation, I believe you're gonna have plenty of time. Just ask around, like, hey, which doctors have like a more flexible surgery schedule and more flexible times, and then you're gonna know who to choose.
I wanted to ask you, what resources did you use for studying for step 1, and do you recommend them?
So for step 1, I did UAG, like everyone. It's a must, you have to do it. I also did patoma, which helped me a lot. Like after I did patoma, I saw like a boost in my score, so that was good. I didn't do any long programs like Kaplan. But I did see a little bit of VIT and past program, but I didn't complete those programs. I didn't pay for any program like these programs that they past program, for example. I didn't pay for the course and anything. I just do it on my own. So basically for me it was UAG, patoma. I did all the NDMEs, and I believe that was pretty much it. It worked for me. For some of the diseases, I'm not good with memorizing stuff. I hate it. I need to understand everything. But there's some stuff that you have to memorize and just get along with it and whatever. So I used Picmonic, helped me a lot with those diseases that had like a lot going on. Aside from that, I study a lot. I believe I did UAG like 2 or 3 times. I know it sounds crazy, and I know people just said like, oh, so you memorize UO because 3 times is a lot. You get to memorize the questions, and I was like, when I was studying, I was like, what? I was doing, I was getting like a 70 to 80% in some of the blocks that I was doing. I was like afraid. I was memorizing questions. So I went to Kaplan. I did this trial of 100 and something questions they give you for free, and I did it like just try to do the questions, and I was scoring almost the same. So I was like, okay, I'm not memorizing stuff. And for me, the key thing about I know it's a lot of information for step one, and sometimes you feel like you have to know everything to pass the test. You don't have to know everything. You have to know enough to eliminate the wrong answers, because at the end of the day, you're not gonna know everything. You just have to know which ones are not. So by the time I was doing my third round of UWorld, I wasn't just answering the question. I was answering the question and saying, okay, this one is not this is not the one because of this. This one is not the one because of this. This one is not because that. And every single one I was eliminating, but I knew why I was eliminating each answer. And sometimes when I didn't know the answer, I was like, okay, let me see what I have here. And I was like, okay, I know this is not, this is not, this is not. And I always ended with two possibilities, like the ones that sound like almost the same or something like that. So between those, like it's a 50-50% chance. So the odds get better.
Awesome. Thank you for that. Yeah, step one is scary, but hopefully by the time we get to step two, it's a little bit easier.
You could
For
say
you-
that.
For you, you took step two CS and CK, right? Or
No.
no? Okay.
So the thing for me, it's kind of complicated. I also, aside from I'm not the same program because I was the fifth pathway,
Mhm.
by the time, to be honest, I got really scared with STEP. I didn't want to fail, but I wasn't taking it. And I was studying. I didn't set a date. So that I got behind on that. So by the time I applied for USME Step 1, it was 2008. I got my title in 2017. I applied for the step, I took it, I passed. Then in 2019, I took CK and I passed. I right away scheduled my CS, but the pandemic hit. So I applied for the CS on December, got it scheduled for, I believe it was April. Yeah, for April or March. Yeah, it was April. And then the test got canceled because of COVID. Since I'm an international medical graduate, they didn't have a pathway for me. They didn't have any options for me. So they said you have to wait. So they made me wait a whole year because I didn't have a unrestricted license. I didn't have anything that let me apply for the pathways. So I waited a whole year waiting for the test. It didn't come out. Then this sixth pathway came out. Like you have to take the OET and you have to do this, and that. I did it. I did the clinical thing with the doctors. I did the OET. I applied for the ECFMG certification. They gave it to me, and I was able to apply for the match.
Awesome. Thank you. So you mentioned that you did the OET program.
Yes.
I was wondering if you can explain your experience with that.
So the pathways are a little bit of a headache if you already graduated from med school, and it's if you graduated before 2018, I believe. So they have multiple options. They give you pathway 1, 2, 3, 4, 5. I believe UAG can apply to pathway 4, I'm not sure. But I wasn't able to apply through that because I got my title in 2017. So that was not an option. The other options they give you is that you can apply if you have a full unrestricted license to practice medicine, which I didn't have because I didn't do the internship criollo in Puerto Rico, how they call it. It's like 1 full year of practicing medicine. And after that, you can apply for a fully unrestricted license. They give you that like that way. So for me, it was waiting for the sixth pathway, which they let you apply if you do 6 clinical encounters with 6 doctors or 3 doctors, 2 clinical encounters with each one. They cannot have like a subspecialty. They have to be like internal medicine, general practitioner, ER doctor, or I don't know, PITS. You can also do with PITS. So they have to monitor you while you evaluate and do the whole patient thing, like the interview and the plan and the note and everything. And there is like an attestation that you have the proper clinical skills of a medical graduate to practice medicine. So after they fill out that form, 2 forms per doctor or 1 form if you have 6 doctors, you send all your stuff and you book the OET. The OET is not that difficult. Some people get scared because you have to talk, but it's really mellow, the talking part, but you do have to study. It's not because it's hard, it's because if you don't know the content of the test, you're gonna fail because you're not gonna know what you're gonna do. There's a part where they are speaking and you hear like a podcast or something and you're just answering questions while there's some podcast going on. There's another part that you have to like comprehensive reading. You just read a bunch of essays and just answer the questions just straightforward. And some of them are interpretation. And one of the parts that you have to redact like write like a clinical note or a referral for another colleague. And you have to be as proper as you can, but just give the information that is needed. Like if I'm referring this patient because he started with back pain and I did this, and that, anti-inflammatories didn't work. I did some physical therapy, it didn't help him. So I'm just referring this patient for you to evaluate for further treatment or management because you are the spine specialist and you're gonna something like that. So that part is also, and the speaking that when you meet with that person, is sometimes it's online, sometimes it's in person. Mine was online. So it's really nice because the first like 10 minutes she talks to you or him talks to you, he explains like this is gonna be like this, you're just gonna read the card. They also ask you like where are you from, why do you like medicine. They try to relax you first and then they go with the questions. So for me, I don't work with this like practicing and doing like a script. I don't work with that. I get into my head and I choke. So the way I treated this part of the test, it was like I'm just gonna talk with the monitor and make believe it's a real patient, and I'm just gonna treat it like I treat it on the clinic or at the hospital. I'm just gonna be frank with the patient, talk to him, educate him, and give a lot of reassurance on the matter that it's their concern. This part is not that clinical because it gives you like this patient comes for otitis media and they give you the definition of otitis media. So you don't even have to diagnose anything. It's just like talk to the patient, and then they need to see that you're gonna be able to talk to a patient like fluently, and there's no awkward silence, and you can like I don't know, like make this connection with the patient. That's what they're looking for. If you do that, you're gonna be fine. That's the OET. Once you get that, it was the ECFMD certification came kind of weird because it says it expires. It's a conditional ECFMD certification for all of the pathways. So they give you a time limit to apply for residency, get into a program, and once you have passed 1 year of the residency program, they confer you the ECFMD certification fully without the expiration date. Right now, when I applied, they give me my ECFMG certification. It was about to expire in December 2022. So if I didn't get into a program, by the time it expired, I had to apply again. For some reason, apparently they saw it was kind of redundant doing the whole process again. So they extended that ECFMG certification and it's going to expire in 2024. But since I got into the program and I'm gonna complete after I complete my first year, I'm not gonna have problems with the expiration date of the ECFMG certification.
I didn't know that that was a thing, that ECFMG certification could expire if you apply.
That's the thing. Before, it wasn't a thing. It didn't exist. Once you pass the CK, the CS, and step 1, you were good to go. It didn't expire. But with the pathways, for some reason, they put it that way because they need to make sure you get into a residency program to complete the years and all the stuff.
Oh, okay. Okay. Thank you for that. Moving on towards your ERAS application, I wanted to ask you, how many letters of recommendation did you get, and when did you ask for them?
So during my 5th pathway, the internship, I asked for a bunch of letters, which at the end I didn't use only one because I kept in touch with the same internal medicine doctor. She was my boss when I was working as a scriber in Arizona. So that's the only letter of recommendation I kept because I applied after I graduated from med school. So that's different for you guys. But the sooner, don't get there and say like, I want a recommendation letter from you because he doesn't know you or she doesn't know you. So it was like, it's gonna be like, yeah, I can give it to you, but you need to make an impact first. Like, hey, I'm here to work, I'm here to learn, I want to do this, I want to do that. And after they know you, ask for the letter of recommendation. Make sure to take the number, like the phone number and the email of the doctor, because if by some reason you have to leave Mexico and start doing rotations in the United States, you can always go back to them and request the letter of recommendation. For me, I got mostly all my recommendation letters here in Puerto Rico. The doctors uploaded the letters, so that's a must. And they also have to follow certain rules because some programs are really picky with the letters of recommendation. They ask like, if you wrote the letter or did the attending wrote the letter. So if they upload the letter, it's better. And if they follow the rules of the, I can't recall the name. There's certain rules that the letter has to follow in order for them to kind of take you seriously. In Puerto Rico, they're a little more flexible, but in the States, they need to follow those rules because if not, it's gonna hurt you for interviews. Aside from that, I got all my letters of recommendations in the internship. I had one of emergency medicine, which was Dr. Roa. I had one from my program director, and the other ones were from my doctor from back in Arizona and some other doctors that I kept in touch with in Arizona. So basically I had like 4 letters of recommendations plus the dean's letter, which is part of your ERAS application. So that technically doesn't count as a letter of recommendation because it's your dean. It's gonna give you a good letter of recommendation, let's be honest. And always, some doctors, they don't like to write the letter of recommendation. They say like, oh, wrote the letter of recommendation for me, and you have to say, you can do it, but it's difficult to write a good letter of recommendation for yourself. Just keep in mind that you can give him like a draft, like, hey doctor, this is like a draft, if you can sit with me, I can modify it, and you can just tell me what do you think, and we can work the letter and just upload it. And sometimes the doctors are really nice and they just say yes. Aside from that, just try to ask for the letters at least 6 months before applying, because you have a deadline. And if you apply the first day of the ERAS like opens, you're gonna have more chances of having interview. And now is a good time to apply because since, since COVID, all the interviews are online. So you are able to accept more interviews and they're able to do more interviews with graduates because it's cheaper. You know, they don't have to entertain you that much. They don't have to give you a tour. They just talk to you in camera, and you don't have to fly and spend crazy money on like hotels and flights and all the stuff. So I would say 6 months at least for them to to know you need the letter, and make sure you upload the letter at least 1 month prior to applying because it takes time. Sometimes it takes time. So also like the paperwork from school, like transcriptions, the dean's letter, the translation of the transcription. There's like a package they offer. It's like, I don't know if it's 150 for the whole thing. So they prepare the whole package for you to apply to ERAS, and it's like 150. It includes the dean's letter, it includes the translation of the transcription. So make sure to do that like 3 months ahead because it's gonna take them time, at least 2 months for them to get it done. And don't let time to pass by. If you see they don't talk to you, they don't send you the stuff, or you don't see it uploaded in the ERA system, make the call. Make the call every single week at the same time, the same date, with the same person. Hey, can I have an update on my paperwork? Or how's it going? Hi, sorry to bother you. I'm waiting for my paperwork. I'm applying this date. It has to be prior this date. Just keep reminding them because they're humans and they have a bunch of stuff. So you have to do that.
Awesome. Yes, thank you for letting us know about the dates too, because I think that's something that we don't really keep in mind.
Yeah, that's definitely important. And every single year they do this schedule like ERAS. They show this schedule like you have to apply by this day. You have to buy the token. It opens on this date. Submit this, and that. And they have it all like by dates. So just download that and keep it in mind. Put it on your calendar. Don't miss a date because it's going to hurt you. At the end, it's going to hurt you on the interviews, like the amount of interviews and the amount of programs. So yeah, that's important.
Awesome. And I'm thankful that you brought up tokens. Can you explain a little bit more about what tokens are and how to use them?
So tokens are like a pass for you to do the ERAS thing. So the ERAS is like a program where you upload all your documents, transcription, your examinations, your photos, everything. So the token gives you access to ERAS, and ERAS is the way that hospitals receive all your information. And you can send this, like you do this kind of little package where your CV, everything is in there, and you just send it to different hospitals, and they're gonna charge you. By the time you're gonna apply, they're gonna charge you for the amount of spots or hospitals or programs you apply. So the token is your gateway to enter ERAS. They're not gonna run out of tokens. Just try to buy it sooner, because if you buy it, you're gonna be able to get into ERAS and start your whole process like right away. So you're gonna have plenty of time to collect all the information you need. And that program, ERAS, is the one that the hospital never contacts you, or at least some of them never contact you directly. They just go through ERAS. They send you an email like, hey, thank you for applying. We're sorry, we completed our whatever interview, blah, blah, blah. If something open up, we're gonna let you know. Or if you get an interview, congratulations, you have been selected, because you did this and that. We have some openings for interview, this and that. Please contact us as soon as possible because those spots fill out quickly, and secure your date and your time. So basically that's to ERAS 2. What else? The letter of recommendation, you're gonna have to send an invitation, like requesting the letter to each doctor So that's two Abrazo. So without the token, you cannot apply.
So tokens, you need one in the beginning?
The token is a number. They give you like a number with the token, and they send it through the email, and you need this token to register at MyEras to begin the fellowship application process or the residency program. So it's this number that identifies you as a candidate for the programs. But there's a second token, and it's not called a token. It's the NRMP. It's another kind of number that you need to get that to complete your application. You can get all the interviews in the world. If you don't get your NRMP registration, it's like $45. You're not gonna be able to match because you're not getting into like the mixer, let's say. So you need one pass to do the ERAS thing and apply and get the interviews, and you need a final step that is like a $45, $50 number is the NRMP, which allows you to get into the lottery, let's say. If you don't get that, you're not gonna match because you didn't complete the whole process. Just be aware of that. They give you until, for me, it was March the 2nd to rank my list and to get my token. Was the token? No, it was prior to that. Yeah, you have until the 2nd of March to get the NRMP something and to rank your list. If you won't be able to rank if you don't have the NRMP because it doesn't let you. You're not there. And also, if you don't have the NRMP, you cannot apply for the Scramble or SOAP, how they call it now. So you need that. Like, don't miss that because a lot of people miss it and they just get left out.
So the second one, the NRMP something, that's something that we do after our interviews.
Kind of. You can buy it after the interviews, or you can buy it like right away after you apply. You can just get your NRMP number just to make sure you don't forget that. And by the time you finish with all the interviews and you're ready to rank, it's already there. Like, you are NRMP, so we can rank your list NRMP because it's something really apart from ERAS. No one's gonna tell you that.
Yes.
You can miss it really easily, and it could happen.
And I think that might have to do with there's like stats on the RMP website that says, oh, these students or these amount of people didn't even match, but not because they went unmatched, but just like, I don't know, they just didn't continue. And so that's probably how.
Yeah, that's how it happens. Like it says here, like the NRMP uses a mathematical algorithm to place applicants into residency and fellowship positions. Like, it's like you did the whole thing, but you didn't got into the lottery mixer mathematical equation. So you're not gonna be able to match, not because they don't rank you, even though, like, if they're trying to rank you, probably they're not gonna be able to rank you because you don't appear on the list. So it could be that, or maybe you appear on the list because they give you the interview, but once they place you, you're like a phantom. There's no way to contact you. You didn't get your spot because you weren't in RMP. So that's important.
That's super important. Oh my gosh. Thank you for highlighting that because I was not aware. I'm 100% honest. I did not know about the second one. I've heard about tokens, but I didn't know quite about it. Thank you for clarifying that too. But the second one, I'm like, okay, now I know.
Make sure to get that and you're gonna be fine. Awesome. And also, for me, what helped me a lot during the match, and I believe I matched because of that, it was the internship I did in Puerto Rico. It's the 1-year thing that confers you the unrestricted license to be a physician in Puerto Rico. It helped me because I was able to get a rotation in the hospital I wanted to get in through them. They don't accept you if you're not in a program. Okay, it's important they know you because paper is paper. They're gonna see a bunch of good letter of recommendations, a good of CVs, a bunch of do assembly steps with amazing scores, but if they see you, they know you, they're gonna remember you. So being on my internship led me to that, and also because I'm in a program like it's not accredited, but it's a program like an internship that is approved by Junta de Médicos. It's like the medical society in Puerto Rico. They confer you to do the internship, and so you have a professional license number that when you apply to ERAS, they ask you, do you have any license, like medical license? And when you are a medical graduate, like, no, I don't, I'm just graduating. But if you take a year, like a gap year or something, and decide to do the internship in Puerto Rico to get the general license, they give you that provisional license, which you can upload into it as like, hey, yeah, I have a provisional license. It's not unrestricted, but it's a provisional license, which I can prescribe medication stuff in hospital. I can make orders and all this stuff. So I believe they see that as a good thing, I guess.
Yeah, I bet it's a good thing because it shows that you know a little bit more, at least, at the very least, even though it's provisional. For those who are interested, though, in that internship program that you did, is there a way for them to apply to it? Because since UAG doesn't do that internship anymore, so for those who cannot do their third year or fourth year rotations in Puerto Rico, is there a way that they can still go towards this internship?
Yes. So after you graduate, they require you to have at least step 1 or the Revalida of Puerto Rico part 1. Once you get that, if you have step 1, you're good to go. If you have the Revalida of Puerto Rico, also, if you have step 1, step 2, it's like, oh, come, like you're great. You have to fill out some paperwork and you apply. There are limited spots, so it's not that easy to get in, but just send the paperwork, apply on time, get your letter of recommendations, you have to open like how do you put that? It's like an archive with the junta, so they have your paperwork, they know who you are, they know you're interested in applying to an internship. So by the time you get the yes from the internship, they're gonna grant you the provisional license once you get the spot in the program. But I believe there's one in Arecibo. This is the one that I'm doing. There's in Manatí, Mayagüez, I believe there's Caguas, Aguadilla also. Just call the hospital, ask for medical faculty, request the paperwork to fill out, start the process. And if you know someone, don't be shy, just ask like, hey, can you give the heads up, just talk me a little bit up, like I really want an interview, I just need the interview, the other part is all you, but just try to get the interview. Once you get the interview, there's a really good chance you're gonna get the spot. And the internship is definitely not easy, not for studying. If you're planning to take the steps while doing the internship, it's gonna be really, really hard because you're on your own, you're treating patients, you're acting like a doctor, like the real attending sometimes, and it's time consuming. You have 24-hour shifts every 4 days or 5, or if you're lucky 6. Sometimes there's not a lot of person, like everyone got sick and there's only 5 interns doing the 24-hour shift, so you get your on call like, I don't know, every 3 days. It's exhausting. It's a great experience. You learn a lot, but just keep in mind it's gonna be a really hard work. If you are good with just like a general practice, a license, you're gonna get it. But if you're thinking about doing the residency thing, it's gonna be hard if you don't have your steps already and you're ready to apply. But for sure, like for me, I had my 2 steps when I applied. I got to rotate. For me, it was like my road to happiness, let's say. So yeah, you can do that. Just call the hospital and I can even forward you some of the forms that I have because I have it on my email. So you can pass it along if someone is interested in doing that.
Yes, please. You can put it in the description box of this video. So whenever I
Definitely.
upload it, it's going to be there.
And I believe the general practitioner license from Puerto Rico can be used in the States. There's some states like, let's say life happens. You're not gonna be able to do residency, you're just tired, you have a family to provide for, you can do the internship for 1 year. They don't pay you much, let's be honest, they don't pay you much, but it's just 1 year, you get your license, and I believe it's good in Florida, in Texas. There's a couple of states, they confer you, they grant you the license, like you can practice like a general practitioner with the Puerto Rico license. So that's something you can look for.
That's amazing. Yes. Okay. I'm glad that we're talking about.
Yeah, a lot of people that I know that got spots because in Puerto Rico you have residency match and off match. So there's a lot of hospitals, they offer you a position off the match. They ask you like, hey, you have to drop the match and we can get you the spot. So you have a lot of opportunities to get into Puerto Rico. Like, it's amazing. And don't get me wrong, in the States, I have a bunch, like a lot of friends that they, from the UAG, they match in good hospitals, great programs. So don't limit yourself, but if you're looking for a way out because you feel like you're drowning, Puerto Rico can give you that opportunity.
Awesome. Yeah, it's always good to know what's out there. So, because like you said, life happens and you never know what's in the road.
Exactly.
Okay, so in terms of applications, how many programs did you apply for?
So I applied to internal medicine, like all the programs of internal medicine in Puerto Rico, and I applied to emergency medicine. Like I said at the beginning, first I was in love with internal medicine. It was my goal, but then like I saw what it was to be in ER, and it was like, oh my God, I think ER is the one for me. I have to be honest, I didn't apply to that many programs because I just got married. My husband is in San Antonio, Texas. He's doing a fellowship on GI pits. So most of our relationship had been like long distance. We finally got married in January and we're trying to do like a happy medium, like, okay, so we're gonna be apart our first year of marriage. We're gonna be apart. So let's settle for Puerto Rico for now. If you don't match, if I don't match, then I was supposed to apply like States and Puerto Rico. So I decided on my own, like, let's do a happy medium. Just finish your fellowship. He's gonna finish next year. Try to come back to Puerto Rico, and I'm gonna apply to Puerto Rico and try to get matched. And if that's the case, so we're gonna see each other next year, and we're gonna be able to live together finally. But if not, he wasn't gonna sign any contracts with any hospital until I matched. So if I wasn't able to match or didn't scramble, I was gonna apply again, but States and Puerto Rico. But we wanted to come back to Puerto Rico, so that's why I tried to keep it low. I applied, I would say, like, so it was 2 programs for ER, which are the 2 that are in Puerto Rico, the one from Centro Medico and the one from Ponce. And internal medicine, I believe it's like 10. So at the end, I end up applying like 15 or 16. And I know some people say like, oh, you have to apply like 40 or 50 places to get an interview. Not really. I got my interviews and I matched, and I didn't apply to that many programs. So it's more like if they have, I mean, let's be honest, some people, they don't rotate and they get matched because they have this great, amazing steps and they did this great interview and everything lined up. But sometimes if you do like the rotation and they see you, you're gonna get the interview because they know you and they prefer a face they already know, and how you work, they know already, they know you. So they feel more comfortable when they know you. But also it can go sideways, because if you go to that program to do a rotation and you don't give your best, they're gonna hate you. You're not gonna get in. And I have friends that for some reason they had some kind of misunderstanding with residents, and it was sad, but didn't leave a good impression. So that like kind of tarnished their reputation. Yeah, in terms of applying, I have friends that they applied like to every single spot in the States and Puerto Rico, and they ended up getting as many interviews as I did. So it's not the amount, it's more like just be strategic, do research. If they like, if you're Latin, just try to apply to Latin friendly places. If you know someone, reach out, like say like, hey, I am applying, if you can talk about me a little bit, so when they hear my name, they like, oh, I heard that name before, and stuff like that. So connections, networking is a must during this process. Not everyone is the same, not everyone applies right like after graduating, but just keep in mind that it really doesn't matter when you apply, you can get matched, because I applied like, let's say 2.5, 3 years after I graduated, and I matched on my first attempt. So you can do it.
Yes. Well, first of all, congratulations on your marriage. And long distance is tough. And I'm so happy for both of you, because you're both, following your goals and still being together. That's amazing. And in terms of you're kind of like auditioning when you're in your internship, or even in clinical rotations. I've heard the same.
Even when you don't think someone is watching, there's always someone watching, because for me, when I went there, I was like, okay, I'm gonna give it my all. I was always there. I was always saying yes. At some point, one of the R3, like the third year residents, like, because I was always like, hey, I can help you. Oh, I can do that. I can do that. And he was like, who are you? Like, where are you from? Like, what are you doing here? And I'm like, oh yeah, I'm sorry, I'm an intern from Pavia Recibo. I'm really interested in the program. I'm applying, blah 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 blah. I have an interview. Like, always, you have to sell yourself, like, it's not like a contest, like you need to charm people, but if you work, they're gonna see that. Also, like a parenthesis on the matter, like my husband, he's a UAG graduate. He did things differently. He didn't match because he dropped out of the match. So he got into PITS on Hospital Municipal from San Juan. They offered him the spot, so he had to drop out. And after doing PITS, he applied for the fellowship on GI, and he got into Baylor Children's Hospital in San Antonio. So he's UAG, he's proud. He had a gap here, and he matched on his fellow. So there's not a right pathway. You just have to find your own pace.
Yes, and just keep at it, looking for opportunities. That's amazing. I'm happy for you both.
Thank you.
So you mentioned that you applied to internal medicine and ER.
Yes.
So did you do 2 personal statements? How did that go?
I did 2 personal statements. The first one, the internal medicine one, I already had it with me because I was working on it for a long time, because for me it was all about internal medicine. But then the ER statement, I believe it was more personal. It had more like passion, I would say, because it was fresh. I was just experiencing that. And don't get me wrong, I love internal medicine, because right now I was rotating with an internal medicine doctor, Raul Rivera de la Vega, and he was amazing. Like, he almost made me change my mind, because he was so good with the patients. I was like, oh my God, he's tempting me. Like, right before the match, he's tempting me. But yeah, you have to do 2 of everything. Like, you have to get your 3 to 4 letters of recommendations for internal medicine, at least 2 of internal medicine, like doctors, and 1 from whichever. And for the yard, the same, like at least 2 and 1 whatever. So yeah, it's 2 everything. It's not bad to apply to 2 things at the same time, but when you're gonna do the ranking, you're like, I love, this is my program, this is the one that I want, but this is like a really good program, like a really good hospital. So you're like, oh, what I do? Like, it's kind of difficult to choose. And also, if you apply to both, like to 2 or 3 programs, when you get the notification like, hey, you have matched, you don't know. You don't know if you match in ER, you don't know if you match in internal medicine or anesthesiology or whatever you match, you don't know. You have to wait 4 days to know. And that's like, it drives you crazy.
Yes, I bet. But I'm glad that you got that first email saying that you matched and that you didn't have to soap or scramble. But what do you know about those processes?
So that process, when it right away, when everyone gets the email like, hey, you have matched, or I'm sorry, you did not match. And there's like a system in NRMP that you go into, and there's these slots, like it appears like all the list of all the hospitals with the unmatched positions, and you just start sending emails and sending your stuff through there. Like, you have to be really proactive there. You cannot say like, oh, I'm gonna check it later, or like, I'm gonna cry a little bit more and then gonna start. No, you have to get into it. Just go to the list and start sending emails. And if you see by any chance that one of the programs you got an interview, you didn't match, and they have a spot available, send the email like, hey, this is me, I had an interview, you guys have a spot available, you already interviewed me, just give me some reconsiderations. So you have to really like send emails, just, and talk to your friends. This process is it's not friendly at all. It's not friendly. But if you do it with a partner, with someone that can guide you, or not guide you, because let's say both of you, they don't know anything. You guys don't know anything and you're just applying. But between you two can like make it happen, because it happened to me during the internship. I met this friend, she's from the UAG, Lorraine Ramirez. She was applying to the match as well. And between the 2 of us, we like connected the dots like, hey, you're applying for this, I'm applying for that, or remember this, or remember that, or use the provisional license. It's a good thing that you have it, just upload it. And remember the NRMP. Like, we kept like in touch, like during the whole process. She matched in pathology in Recinto de Ciencias Médicas. And I believe, like, I really believe that having her during this process, it helped me. It helped us. Like, we were there. Like, we applied on time. We got our interviews. I studied for the OET thanks to her, because she was like, you have to study. Like, keep in mind. I was like, okay, I'm gonna study. Okay. Because I didn't know how was the test. She already took it, so she kind of let me know like, hey, is this and that, and I'm like, oh, okay. So I then did some research and like, okay, I have to study a little bit more. But yeah, if you have someone that's applying with you, just talk to them. A lot of people, they don't like to talk about applying to the match, because they get like, oh, I don't want to tell you where I'm gonna apply, or if I got interviews. Those people are not too great to work with. Just try to find someone that is really open and honest about their whole process, so they help you and not give you more stress about that.
Yes. Oh, I'm so glad that you had someone, because there's a lot to know and a lot of deadlines. So, and you're right, you have to find the person that is willing to share information and wants you to succeed as well. Awesome. Okay, so in terms of your ERAS, I was wondering if you could speak about the hobby section and the certificate section.
So the certificate session, I'm not sure, I don't recall well the certificate session, but the hobby area. So I'm really an outdoor person, so I like to hike. I love to play tennis. I love to play volleyball. I love to go and dance and do concerts. And for me, that area of the hobbies is a little bit tricky because people sometimes try to fill it out with extracurricular activities like outreach programs and all that. But what for me, at least for me, what they're asking is how do you blow steam? How do you separate your work, study from your life? Because if you don't have any of those, you're gonna burn out. And they don't want a resident to get burned out during residency because they're gonna lose him or her. So for me, I just put like tennis, volleyball, dancing, and even in the interviews, they asked me, how do you blow steam from the residency? And I'm like, how would you do it? And I was like, to be honest, I just go out, I walk my dog, I play tennis when I find someone that can play tennis with me. If not, I listen to music, I go dancing. I even go dancing on my own because my husband is like far away, so I just go dance with my friends. Like yeah, like you just have to show them that you also have a life outside med school. They want someone that can interact with people, that can interact with the team, because you want a team. You don't want a resident, you want a team. A person that can integrate to your team is what I believe they're looking for with the hobbies. And the certificates, aside from the ECF&D certification status, I don't think I did any of that. But if you have something during your med school, that's great, because they're gonna say like you're an overachiever, and that's amazing. You know, like they're looking for people that they want to be on top of stuff, but also have a life.
Yes, of course. I wanted to ask you if you think there's something that we have not talked about from the ERAS or the matching process that you think is important.
Okay, let me see. For the essay, don't tell your whole study, because sometimes, remember, they have to read like 500 applications and you want to make an impact with your essay. So just try to be straightforward, be passionate about it, and don't exceed about from the, I don't know, 1.5 pages, because they have to read every single one. And if they get bored, probably they're not gonna read it all. So just talk about you, your passion, and why do you want that specialty. Like, not why you got into medicine, because you already did medicine, you already got your title of doctor, you already completed that. That's great. They know that, because if not, you're not be applying. So just make sure to tell them why you and why them, why that residency. And the same with the interviews, keep in mind how you see yourself, because sometimes they just ask you medical stuff like, do you know this, do you know that? But there's some other places, other hospitals, programs, they want to know you. So they want to know how you see yourself and how you see yourself in that program, and why you. Why should I choose you instead of the other 500 candidates that I have in line? Sometimes they ask you in the interview, like, describe yourself with one word. And I know a lot of people say resilient, and that's an amazing word. That's great, because everyone struggles, everyone tries to make it, and it's difficult for everyone. But that word, everyone uses that word. Like, together you have to be. So try to find a word that describes you and only you. that you need to make a splash, you know. You don't need to be like one of yeah, next she said the same, like of the like the other candidate like 5 minutes ago said the same you said, like in their minds. So for example, for me was like one of the interviews, they asked me, so why should I choose you, and how do you describe yourself with one word? Because you're an international American graduate, you have gap years, and what if I have like a recently graduated student that is from the States or from Puerto Rico that have better scores than you, that don't have gap years in their curriculum? Why you? What makes you so special? So what I answered to that was like, oh well, my work speaks for itself. And also the word that I think it made the difference is that it was in Spanish, the interview, because I was in Puerto Rico. Oh. So I said, like, I can recall or I can translate the word, but for me, what describes me is that I'm resourceful, because it doesn't matter what you give me, I'm gonna find the way to solve the problem or find all the possibilities to solve a thing. Like, I'm gonna do everything. I'm gonna try to solve it no matter what. And I'm gonna reach out and I'm gonna call and I'm gonna run. And if I have to jump, I'm gonna jump, because I'm resourceful and I'll try to make it happen. And that's how I am. And when I said that word, like resourceful, I saw like the face of the interviewer like change, like, oh, finally something new, like, wow, it's nice to hear something different. So with the statement, you have to do the same. You have to do the splash, like try to start your statement with not like a quote, but something deep that you can grab their attention and say like, hey, maybe let's say this person doesn't have the best scores I've seen in my life or the best extracurricular activities, but there's something about the way they write that I like, and I want to know them, interview them to see if that feeling is true. Like that, it's important.
Awesome. Yes, you're right. I didn't really know what to ask for the personal statement, but it's very important to take our time, and especially for me, I don't consider myself a strong writer, so I think I have to like put lots of time into
There's
it.
also people that you can hire to help you. They don't write you the essay, they help you with the essay. So you just do the first draft, you send them to them, and he make or she make the corrections, like, hey, just go back and do this. And maybe you end up reviewing that same statement like 30 times, because they're not gonna write it for you. They have a way to write, and they don't want to clone themselves. They want you to find your own words, but change it a little bit and to sound like captivating. So you can try to find someone online that can mentor you through the process of the statement, so you can have a strong statement. That can also help.
Awesome. So my last question to you would be finishing statements for UAG students.
For UAG students, so like I said at first, there's not a perfect school. Like there's no perfect medical school. UAG gave me so much. The process was hard. Sometimes there's some delays with the paperwork. It happens in all medical schools, but I'm proud to graduate from UAE. Like the experience I got in Mexico, the tools they gave me, like I can't explain it, but maybe UAE is not like the first choice for medical school because it's from Mexico, but for me, I will do it again. I will go back there and I'll do it all over again, because when I match and I saw my residency program, they do this congratulations to all the match people. And to our new residency, whatever residents, thank you, la 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 la. When I went one by one of my future teammates, I saw like UPR Puerto Rico, San Juan, UPR Puerto Rico, UPR Puerto Rico, UPR Puerto Rico, like everyone was from UPR Recinto Puerto Rico, or from Caguas, which is another medical school in Puerto Rico, which is US. Like Puerto Rico is basically US. Like you don't have to do the whole
PCFMG
and all the stuff. So I felt so proud of myself. Like I was like, oh my God, like I made it, I matched, and I matched in a program where there's only one international student, and that's me. And I had my gap years, and it took me a while to get there, but I'm the only one, and I made it on my first try. And all of them, they know them, like they know each other because they're from the same school, graduates from the same school, same year, same everything. I'm the, let's say, I don't like to say underdog, but kind of the underdog and the outsider. But yeah, and it made me, I don't know, it made my day. Like I feel like I'm so proud to be from the International American graduates, to be from the UAG, to have all this experience, and yeah, just be happy about your school. It's not good to, sometimes you don't get the best experience international and with the school and with the staff. It happens because it happened to me, it happens to everyone. Don't down talk your school, because at the end of the day, you're down talking yourself because you're from there. Like that's your school. It doesn't matter how imperfect or perfect it is, that's your school. Like you represent that school no matter where you go. You're gonna be always a UAG graduate. So just be proud, make the best, and just try to open new doors to those that comes after you. Because let's say I go to residency now, so I'm gonna be a UAG represent, for them to take more notice on those from UAG and those international graduates that sometimes don't make it because they're from the international. So just be proud of yourself, be proud of your school, and you're gonna make it.
Awesome. Thank you so much for taking the time to answer all of these questions very thoroughly. I appreciate you lending your experience, being so open with us so that we can learn how to make our way into whatever specialty that we want to go into. And we wish you the best of luck. And I'll put your, if you don't mind, the IG handle on the description so that we can follow you through your journey. I think it's just amazing to see, UAG alum who like move on like in their career. So thank you so much once again.
You're very welcome, and you are guys welcome to follow me or reach out to me, questions. If it takes some time for me to answer, I'm gonna answer. I never unanswer, like I always answer. And it was amazing, like all the questions, and thank you for letting me share my experience.